So we've finished the preparations, we've made our final impressions, we've got our bite registrations, everything we need, and we're ready to fabricate provisionals. We're going to clean our preps with some type of chlorhexidine rinse. We're going to rinse this off to this antimicrobial agent to disinfect the teeth, and then we'll go ahead and we'll spot etch the teeth. We put a little etch of phosphoric acid gel right in the center of the tooth, allow that to sit for about 10-15 seconds, rinse that off, lightly air dry, and then we'll come back and we'll paint those areas with some bonding agent. We're now ready to go ahead and seed our provisionals. Seed our matrix. We'll go ahead and put some material, provisional material. In this case, we're using Pulp Dent's Tuff-Temp material, which I like a lot, and also DMG has a great product, and their Zenith product is a really good product. We use that a lot of times too, and Tuff-Temp is their temporary material. And we go ahead and fill our matrix, and one little caution here: if they're a very thin veneer, if it's a minimal prep veneer, you don't want to put a lot of material in the tray. That way you'll have a lot more excess. So just put a small amount just in the facial surface of the matrix. And then we'll go ahead, and here we see the Tuff-Temp, and some of the things I like about it is it's got their new rubberized urethane technology. It self-cures with a light cure option, meaning that if you use a clear matrix, you can go ahead and light cure. You don't have to wait for it to self-cure. It's tough and fracture resistance. It's good for long spans, and it doesn't shrink or distort, which is also beneficial, especially if the restorations are going to be in the mouth for a while. Grips the tooth tightly, and it doesn't. It's very easy to trim. It doesn't gum up the burrs when you're trimming it, and the fluorescence adds some aesthetics to the final temporaries. So after it's been in for about 2 minutes, we're going to remove the matrix, and we're going to see our temporaries, and we'll see a little bit of excess gingival, and every now and then we're going to see a little bit of you might get a little void or a little bubble or something like that, and we can take some flowable composite. And most of these temporary materials have a compatible flowable composite. It's really easy to fill these little bubbles or voids in. And then we're just going to shape these, and we're going to trim away the excess.